Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Phenomenal questions. We thoroughly appreciate each and every one of them. Hi Dr. Bob, I want to keep my blood pressure down naturally, and what supplements and food to take. The best way to help manage your blood pressure is magnesium. We use a liquid magnesium in our practice. We also use a magnesium orotate. It depends on what's going on with you. If you have constipation issues, we use one type of magnesium. Heart palpitations with blood pressure, we might use a magnesium orotate. If your blood pressure is really high, we use a liquid magnesium. So you might want to contact us. The best food for high blood pressure is greens. Anything green has magnesium in it. Dr. Bob, my 26-year-old daughter has shingles under her arm, a couple spots starting to scab. Wanted to know what can you do for speedy recovery. Well, there's not necessarily anything for speedy recovery. First, we use a product which is called, it's a Zorex spray, and you can spray that on the area, but by the time you watch this video, her shingles may be abated. It's called Complete Care Spray. Also, what I have found, individuals who have shingles tend to have lack of calcium and oftentimes lack of B6. It's usually a virus. Now, it's very interesting is where if she was around anybody that might have had any recent immunizations. Because I'm seeing that more and more when people have a weak immune system and they're around a child or a daycare center. That spells trouble because of lack of calcium and, of course, the virus. We had individuals that said that her and her husband were trying to have a baby. He's having some challenges with his sperm. It's not natural. They want to inject him with some hormones and the whole in vitro type of route. I can tell you that from my experience, we use a product that has parotid tissue in it to help assist in abnormal sperm motility. If it's a chromosomal issue, you know, that's a whole nother challenge, but we use a product that is based with the neonatal glandular parotid. We also use oils. We also would suggest zinc. So we need to drill down to find out exactly what's going on, maybe even an essential fatty acid blood spot test. There's someone here that for 8 years have been getting spinal correction. They have a sacroiliac joint that has lots of instability. Must have went to visit a healthcare provider that was talking about adjusting the upper cervical, then mentioning the fact that their body has lax ligaments. When somebody comes into our practice and their vertebra, their spinal segments are not quote-unquote holding, it's usually adrenal exhaustion. Have your blood pressure taken sitting, then standing. If your blood pressure drops, we have a specific protocol to support adrenal function. But you're going to want to stay away from sugar. The adrenal gland impacts your spine because it affects a muscle called the sartorius. The adrenal gland, as other glands, have association with muscles. The adrenal muscle is sartorius. We support adrenal function. Stay away from sugar. Very interesting question. Somebody happened to be on a U.S. Navy vessel that was right outside of Japan when we had the meltdown, was concerned because of the various amounts of radiation that they were being exposed to, and just wanted to know what to do. Well, I'll tell you, probably the best thing to do would be a urine iodine loading test. Why? Because if your iodine level is low, you want to support that. Just something that I've kind of read along the way. You may consider a mineral tissue hair analysis. I would be looking at your cadmium level, if it's elevated or not. If your cadmium is elevated, we want to support that, trying to get the toxins out of your body. We use chlorella sometimes. We also use a product to support glucuronidation phase 2, which is calcium D-glucarate. My suggestion to you, obviously, would be to start with iodine. Tremendous questions, very intriguing. I know this will make a difference for someone. I'm Dr. Bob DeMaria.